Welcome to the in-service, the nurse aide, and the older adult. Successful completion of this module, along with the abuse and neglect presentation, will award you 12 hours of credit towards your in-service requirement. Thank you for choosing ACE Nursing Education Services. My name is Rachel Lozano, and I will be facilitating the course. As we begin the course, you will notice it is divided into 3 sections. The PowerPoints are meant to be viewed first. Next, you can explore the links and videos at the bottom of the page and gain information and insight into the older adult. Finally, you will take the quiz at the completion of both pieces. Each participant must take the quiz and receive a passing score of 70% or better. Don't worry, you should be able to pass the quiz without difficulty. You can always refer to the previous sections or retake the quiz if you do not pass on the first try. Passing the quiz will serve as completion of the course. The quiz results will be sent to ACE, and upon evaluation of the score, each participant will be emailed a certificate of completion at the end of the course. If you need to retake the quiz, you will be advised of this via email. Please make sure you retain this for your records, as duplicate certificates will not be issued and may cause you to take the course over again. For the entire course, we will cover these objectives. By the end of the course, the nurse aide will be able to identify physical changes related to the aging process in the older adult, discuss psychosocial issues congruent with aging to include situational stressors of disease and change of environment, and finally, relate specific safety concerns of the older adult and the nurse aide role in maintaining a safe environment. First, let's start by defining who the older adult is. This individual is generally defined by the age of 65 or older. With the baby boomer generation reaching full retirement in 2011, healthcare and service needs are anticipated to grow for the older adult. The older adult is subdivided into several categories. The young old is 65 to 74 years of age. The old is 75 to 84 years of age, and the oldest old is 85 years or older. This oldest old group is the fastest growing segment of the total population, who is now 80 and over. Their growth rate is twice that of those 65 and over, and almost 4 times that of the total population. In the United States, this group now represents 10% of the older population, and will more than triple from 5.7 million to over 19 million by 2050. The nursing assistant may encounter the older adult in many care settings. Some of these may include home health, clinics, hospitals, nursing facilities, assisted livings, or extended care facilities such as long-term acute care centers or rehab centers. The older adult has special needs. This population is a special group due to the aging process and issues that surround them. Risk of injury due to the aging process, risk of abuse, neglect due to their vulnerability, physical changes in body systems, and psychosocial issues related to relocation, death of loved ones, and disease or disability affect this population. Many changes occur in the physical body as we age. These are considered normal changes, and by understanding them, we can better care for the elderly. Physical changes occur in every system, and often more than one system may contribute to functional problems in the elderly. The integumentary system, or the skin, changes in appearance with the gradual development of wrinkles, age spots, thinner skin, and gray hair. Fragile, dry skin occur due to the lack of collagen and hormonal changes. In addition, thickening of the nails occurs, and less effective temperature regulation results from the changes in fat cell composition and deposits. This is often why a patient may complain that they are cold, even when we feel comfortable or warm. These changes in the skin system place a patient at risk for skin breakdown or pressure ulcers. The nurse aide has a very important role in the prevention of this problem. Turning and repositioning alleviates pressure to the tissues, which is the primary reason for ulcer development. turning and repositioning should take place approximately every 2 hours. In addition, the nurse aide can observe and report changes in skin color or open areas. They can provide good skin care and peri-care, reduce friction and shearing when moving a patient in bed by not sliding the patient on sheets, and getting help when needed. Reduce pressure by using pillows over bony prominences, and apply pressure-relieving devices such as booties or heel lifts. And finally, good nutrition and hydration help the body regenerate and repair skin cells. The musculoskeletal system, which consists of bones, joints, and muscles, also undergoes changes related to aging. Decreased bone density makes bones more porous, which makes them weaker and more susceptible to injury. Decreased muscle mass decreases strength and mobility, and wear and tear on joints decreases range of motion and stability when walking. These changes place the older adult at risk for osteoporosis and fractures. The nurse aide can help by preventing injuries and falls, being gentle with care and ADLs, as a person with severe osteoporosis may break a bone even when turning in bed. Use 2 people for frail elderly individuals, even if they weigh very little. Exercise and range of motion can help keep joints moving and strengthen muscles. And weight-bearing exercises can increase bone density and decrease fracture risk. Always report falls, injuries of suspicion, such as areas of bruising or swelling, patient complaints of pain, decreased muscle strength, limping, as soon as you see them to the nurse. The respiratory system undergoes changes as well. Lung tissue becomes less elastic. Lung tissue expands when breathing in and recoils when breathing out. Changes in elasticity make ventilation less efficient, causing less oxygen to get in or out of the alveoli, where air exchange takes place. Elderly are also at increased risk of infections due to changes in their lungs and immune system. The respiratory system in an older adult may place them at higher risk for pneumonia and flu. Also, chronic lung disease such as COPD can occur. The nurse aide can help prevent the flu by immunizing themselves. Receiving the flu vaccine annually can help protect you and the patient from the flu. In a young, healthy person, the flu may be an inconvenience of being ill and missing work, but for the older adult, the flu can mean hospitalization or even death. In addition, the older adult should be immunized against the flu and pneumonia. The nurse aide should be sure to provide oxygen if it's ordered for the patient, and also observe and report any shortness of breath, coughing, wheezing, or noisy breathing to the nurse. The cardiovascular system is greatly affected by aging. The heart is a muscle, and over time the muscle weakens, causing less efficient contraction of the heart. This will affect circulation of blood and oxygen to the body. Stiffening and hardening of vessels occurs, which narrows the vessels and causes hypertension and clot formation. Also, a decreased number of blood cells may lead to anemia. This places the older adult at risk for anemias, heart failure, coronary artery disease, and clot formation. The nurse assistant should observe and report any chest pain, abnormal pulse rate or rhythm, activity intolerance, bluish skin color, or any swelling or redness to the legs. The brain undergoes changes related to aging as well. Slower conduction time decreases the ability to transfer information as quickly, resulting in slower response times and reflexes. The normal aging process makes the brain slower, but does not affect memory or mental sharpness. However, memory changes related to disease, such as cardiovascular disease or brain disorders, are common in the older adult. This increases the risk of strokes, Parkinson's disease, dementia and Alzheimer's, and head injuries. The nurse aide should allow additional time for tasks and communication. They should prevent falls and injury and report changes in mental status, speech, or weakness to the nurse. The sensory organs, such as the eyes, ears, smell, taste, and sensation, are all affected by aging. Decreased visual acuity, decreased hearing, taste and smell are decreased, and decreased sensation are all common in the older adult. These changes place the older adult at risk for eye disorders, hearing problems, weight loss, and injury related to sensory changes. The nurse assistant can help by providing assistive devices such as glasses or hearing aids, providing adequate lighting to help with vision. And also, since taste and smell are affected by aging, this leads to a natural decrease in appetite and may trigger weight loss. Making food appealing, providing a pleasant environment for meals, and seasoning food can be beneficial. When communicating, speak clearly and face the patient. The aging body decreases levels of hormones which are produced. This finely tuned body system becomes less effective as we age, resulting in imbalances which may lead to disease. There are many hormones in the human body, but some notable ones in aging include the thyroid, insulin, and estrogen. The hormone imbalances place the older adult at risk for diabetes, thyroid dysfunction, and estrogen plays a role in bone health, which may also lead to osteoporosis. The nurse aide caring for the diabetic patient should observe and report meal intake, including refusal of meals and consumption of food from outside sources, such as visitors. In addition, vomiting, shakiness, sweating, extreme thirst, frequent urination should all be reported to the nurse. The digestive system starts in the mouth, including mechanical breakdown of food from the teeth. It also includes the stomach, intestines, colon, and rectum. As we age, less efficient chewing and swallowing can result from poor dental conditions and weak swallowing muscles. Also, slow digestion and slower gastric motility affect the feeling of fullness, absorption of nutrients, and elimination. These factors increase the risk of constipation, swallowing difficulties, choking, and bowel obstruction. The nurse aide can help by providing assistive devices such as dentures, following prescribed diets and liquids, which may be thickened to help slow the swallow and prevent aspiration of fluids. Encourage fluids as appropriate. Although some patients may have a fluid restriction, most can and should have adequate fluids to prevent constipation and promote hydration. Observe and report for any coughing, difficulty swallowing, constipation, abdominal pain, or poor fitting dentures to the nurse. As we age, the urinary system undergoes various changes. Kidney function declines, resulting in less efficient filtration of waste. Decreased muscle tone occurs in the pelvic floor muscles, making it more difficult to hold large amounts of urine or to hold them for long periods of time. And in men, the prostate enlarges, which may affect their ability to completely empty the bladder. This causes a risk for urinary tract infections, incontinence, and urinary retention. The nurse aide can assist by assisting with toileting frequently, encouraging fluid intake to decrease the risk of urinary tract infections, and observing and reporting any changes in urinary incontinence or patterns, decreased urinary output, foul odor, or any dark color. In addition to the physical changes of aging, the older adult undergoes many psychosocial changes as well. These changes affect the mental wellness of older adults, and while they may be part of the aging process, being aware of these issues helps us give more compassionate and appropriate care. Physical changes and disability may cause anguish in the patient. Imagine no longer being able to care for yourself or completing simple tasks on your own, such as going to the bathroom or showering. These changes may result in frustration, anger, or depression in the older adult. Changes in living environment can severely disrupt the older adult. Changes may be necessary due to no longer being able to care for themselves or due to financial hardships. Grief and loss may be present due to the death of a spouse, siblings, or other close family members. This may increase isolation in the older adult as they have fewer people to support them. In addition, isolation can be a result of limited physical ability to travel, drive, or use public transportation. Changes in environment can be devastating to the older adult. They may be situational, such as hospitalization or a rehab stay, or they may be permanent, such as a move to an assisted living or admission to a nursing home. The nurse aide should be sensitive to these changes. Often when environments change, the patient is more likely to become injured due to being unfamiliar with the new place. In addition, they are undergoing a stressful situation, and we need to be sensitive, patient, and caring in our interactions. Various safety issues affect the older adult. These include falls, burns, motor vehicle accidents due to decreased vision and reflexes, and higher risks for abuse and neglect due to their isolation and vulnerability. The physical changes in aging increase these risks. As stated before, the risk of injury in the older adult is high. We must prevent injury in the older adult by providing assistive devices, such as mobility aids, which could be canes, walkers, wheelchairs, and sensory aids, such as glasses or hearing aids if they're needed. Anticipating their needs, especially in new environments, can help the older adult. This can mean providing items within reach and a method to contact the nurse aide. Also, providing a safe environment, such as adequate lighting, clear pathways, proper footwear, can help prevent injury. To summarize, the older adult is age 65 or older. The aging process results in body changes, which are a normal process. Psychosocial issues are present for the older adult and affect their mental health, and safety is a high priority for the care of the older adult and preventing injury. Congratulations! You made it to the end of part 1 of the course. Scroll down on the page to explore the links, documents, and videos, which will give you more information on the older adult. After that, take the quiz to test your knowledge.